Good morning, good evening. It is a pleasure for me to be here with you. We're going to talk about very exciting topics, but as you know very well, the area is extremely complex. I want to say also buen dia, buenas noches, buenas tardes a nuestros amigos que hablan español, os falantes português também, and grüße für unsere Freunde in Salzburg that are also connected. One of the things I want to do right now is just to begin from right now, the present, and go back to the past, in the sense, well, listen, the past in the situation of the COVID-19 has been very recent. The things have changed in the last 6 months or 7 months is incredible. So one of the things I want to do in this particular case, given that it's artificial intelligence and automation, is to see this evolution and to try to look at it from a different perspective. Society 5.0 or Industry 4.0 also. But I am a business but data person, so the idea here is to show you the data for you to draw your own conclusions. This is the present. One of the things that we are seeing right now in Tokyo, as you know very well, Japan is one of the biggest developers of robots in the world, together with China and United States. A very interesting approach what happened in metropolitan Tokyo, especially for the people that had COVID-19. The Tokyo government has decided that some of the hotel rooms that had not been used simply because there were no passengers or tourists coming, to be allotted especially for people with COVID-19, of course, those that have a very mild situation. As you could see very well, you have two boxes there, two robots, one that is going to greet the people in the hotel and is going to remind them evidently to wear a mask, and the other one that is the cleaning. We have seen from a governmental point of view the following. Look at the following situation. It said corona patients with light symptoms arriving to stay at several Tokyo hotels are likely to get a lift from a pleasant surprise, a robot that reminds them and asks them how they are doing. The idea is very simple. In order to reduce the burden of the medical system, Japan has secured more than 10,000 hotel rooms around the nations, in which what are they doing there to use the robots to clean, to greet, and at the same time try to minimize the burden on the medical system that you have in Japan. A typical situation would be, as an example, is look at a hotel, the Roiguko Hotel, that will admit 300 patients with COVID. You have to have the robot to give them a hand, but in the hotel there are going to be two nurses around the clock, just in case something happened. If you combine all the rooms, 10,000 rooms was the idea. They have already allotted 2,800 rooms. And if you think here is in which way a government like the Japanese government is working together with the private industry, you know very well that one of the most affected area with respect to the economic situation has been, unfortunately, the service industry. And this is the typical situation. Pepper, you might have heard about Pepper. Pepper is a humanoid robot that is manufactured by SoftBank that is all over the world. So ideas that the paper is saying, wear a mask when you're inside. I hope that you recover quickly. One of the elements that we have discovered with COVID-19 is isolation and loneliness in different people. Imagine if you're put in a hotel room because you have COVID, you know all the help that could give you from an automation point of view. We have seen the robots previously, especially this is in Italy, April 9th, patients in the intensive care units. Remember that the Italian system of medicine that is very good has been totally overwhelmed. So it's one way, I know you could see the patient very clearly. I don't know how the little robot is going to jump the cable that you see there, but it's one way of interaction. Why are we doing this? Why do we want that automation plays such a big role in COVID-19? For different reasons. One of them we have discovered, death, this is from the UK, death in England and Wales per 100,000 workers adjusted for age. We are seeing that those people, doctors, nurses, and any caregivers have a higher probability of dying. If you look at there, the top one is lower skill elementary occupation. Number 2, care and leisure and other services. And then process plant and machine operative. You know very well all what happened in the butcher shops around the world that the people are contaminated. So imagine in this particular case, what we're doing here is to use automation not only in the old way that we're going to be much more efficacious or in the old problem paradigm that jobs are going to be lost. We're in a situation right now in which we realize that unfortunately with COVID-19, we are minimizing the risk of people to die because of COVID-19. And this situation is very important in Latin America and other places. Let me give you an example of what I'm talking about. This is information from the Folha de São Paulo, one of the most important newspapers in Brazil. And they're looking at the number of deaths associated with COVID-19. This was in May 2020. Right now, the numbers are going to be higher. So you have Brazil, 137, United States, Spain, and Italy. Please observe also the gender difference. 64% of the people who died, especially in the nursing community and doctors, were women against 35% of men. So in this particular case, Brazil, as you know very well, right now is number 2, surpassing easily 2 million. Today is a sad day in the US because today we have surpassed the barrier of 4 million cases. As you can see very well, what we are seeing is that automation could be a solution in many ways to minimize these sort of situations. The problem is that only developed countries or rich countries would have the luxury of using this sort of automation in order to be able to do this. This is automation, but if you put it in perspective, in order to have good automation, one of the things you have to have is artificial intelligence. One is the soul, artificial intelligence, and the other is the body that are working together in order to be able to do. So one of the things that we are seeing in artificial intelligence, there is a lot of investment in different areas that I will define later on. These are the data from 2018. There are some topics, as you see, is highly related to the fight in COVID. Machine learning applications, in which way I could improve and understand the data much better and interact with you. Machine learning platform, smart robots, as the one that we saw in Japan and some other places, computer vision platform. So in order to realize when you're manufacturing or dealing with a human being. So I'm not going to go through all of them, but one of the elements that I want to explain that given that artificial intelligence is the soul in many ways of robotics, all this investment is going to evidently create new ideas and new approaches in this case. A simple example of artificial intelligence and big data is how do I gather data? So in other words, I look at the number of patients that I have that are infected with COVID-19. I begin to realize that one of the things that they have in common is some sort of cough, some sort of first reaction. So we need data, and the only way to have artificial intelligence that works is to gather data in different ways. Some ideas are very simple. Let me show you. Microsoft and IBM and Samsung are the one with the most patents in this particular case. Companies with the most IE patents are Microsoft, IBM, Samsung, and what we see right now a drastic increase from 2008 to 2018 that you could see there. The spending related to that is increased tremendously. The projection in this particular case of IDC is that we spent in 2018 $37.5 billion in everything related to artificial intelligence, the development, the production, and the deployment. And we expect to spend $97.9 billion in 2023. So all the patents that you see, they are created by these organizations. Well, not only the big organization are spending money, but the scientific community need to understand in which way I could gather data. If you have the time at home later on, let me show you a website that is very useful, elementary way. As I mentioned to you before, the World Health Organization has reported that almost 70% of COVID patients experience some sort of cough, a dry cough. So the idea is try to create an algorithm to determine when you cough, if I could make a prediction model to check if you have COVID-19 or not. So there are two websites. This is created by scientists. COVID2.com, that is French site, and COVID EPF of Switzerland. So what do they do? It's something very simple. You connect into the website and you begin in a silent environment like this one that I have at home, begin coughing in order to determine. Of course, you have to follow a questionnaire to ask you if you have COVID-19 or some of those. This is one of the simplest way for artificial intelligence of creating a model. The reason I show you this because, first of all, if we took the French one, the French call it prêt à tousser pour la bonne cause, not just one good cough for a good cause. It's trying to create a model. It needs some data points. The authors want 200,000 data points, 2,000 cut from you in order to be able to help to create a model. This is not only the big organization that you have here are working in the deployment of artificial intelligence, but at the same time, universities, small universities, are trying to create predictive models. Unfortunately, those predictive models need data from the past, data from the present, but at the same time, data to be able to forecast. Well, let's go back for a second. This is what I want to talk in general ideas. Let's go back to the situation. What happened at the beginning of the year? So at the beginning of the year, this is a report for the Economist Intelligence Units. They tried to determine in 2020 which were the 5 risks of the global economy. As you see very well, some of the risks were latent at that particular moment in time. You have the US-Iran conflict leads to a spike in global oil prices. A trade war breaks between the US and the European Union. Debt burdens cause a recession across emerging markets. Hong Kong protests cause an exodus from Asia's biggest financial center. And number 5, that was not clearly delineated in the middle of February, the coronavirus take a lasting toll on the global economy. As you can see, some of the things that they predicted, especially 3, 4, evidently 5, was an important element that it's occurring in this particular moment in time. They say, listen, what happened if the coronavirus that we are looking emerging, especially in China, but not so much in the rest of the world? So this is what they say. Listen, we're going to have problems. They saw it from the economic perspective. The global economic input, the coronavirus outbreak is to set more profound of severe acute respiratory, owing to a much larger role that China plays in the global economy. Let me say it again. They were concerned that SARS or COVID-19 is going to have a great influence in China. And also the idea of the tension between the United States and China that is going to re-escalate because of the COVID. So they were concerned that in this particular moment in time, that the problem was limited for China, but anyhow is going to influence the economy of the world, given the tension between the US and China. As you could see, many of the things happen here. Now, one of the elements that I need to emphasize here, we are in evolution, a constant evolution of science and technology. Generally, what we talk about is Industry 4.0 or the Industrial Revolution. A typical example of the Industrial Revolution is a simple photograph, just to show you. For example, I don't know if you can see the difference between 2005 and 2025. Please observe, in 1905, one of the things that you see is New York is the same photograph and in 20 years difference. In 1805, which you could see, it's a society in New York that is run by horses. In 1925, you see a society runs by cars. Now, the reason that is an industrial revolution, because first of all, there was a change in employment and change of custom, a change in society. And now, in 1805, horses were everywhere, and all the change associated with that. Veterinarian, feeds, the horses, the people who drove the horses and things like that, or rode the horses. In 1925, where we see a totally different society. This is an industrial revolution. Automation, Industry 4.0 is the 4th industrial revolution and the 5th of its kind. Certain things change in society that I would say in this particular case has increased and is a big hit to the society. certain things didn't change. Let me show you some photograph between now, the color photograph with the mirror of Washington, and the different pandemics in different parts of the world. The photographs with the soldiers, which have a very old typewriter, was 1918. And then also there were some other concerns in 32 and 32. It seems to be that one of the things that they did not change is the awareness that the people have to protect themselves. The use of mask in the Western society is not something new. So the people try to be creative, especially in London, with the different sort of pandemics that we have. So certain things change drastically. Certain things didn't change. They didn't change simply because pandemics, as any other situation, earth-shattering situation in the world, is come back in particular moments in time. Now, evidently, when we talk about robots, that is an industrial revolution, there are some jobs that are going to be lost. This is, in this particular case, a risk. Which is the automation risk? Which is the probability that your job is going to be replaced? This is from an OECD last year. You could see some of them could be high probability risk: food preparation, construction and cleaning, and driving. So all these people here, even personal services, I think this risk has increased with COVID. One of the ideas is that we needed to push the robotics, everything that we dream about robots, in order to be able to handle this situation. But we have to be careful. It's not only the service situation, and some other situation is also related to the information technology, science and engineering. As society is evolving so quickly, are we preparing the students, especially the engineers, the people in the universities and education, to this big change? And this change has accelerated. So as you see here, well, listen, I am a professor, so it seems to me I am the last one, says teaching. The probability of automation is going to be less. But honestly, with all the changes that we have, we need to have its different education and ask ourselves if the system of education is adequate for this situation. Now, we ask engineer, my PhD is in engineering. So the question is, what do the engineers need right now in order to be able to handle automation, artificial intelligence? So the strange thing is with engineers, of course, engineers like mathematics and complex physics, but one of the last statistics determined that what we need from an engineer, we need from somebody who is working in artificial intelligence or any other area, that the first thing that they need is reading comprehension. They need to understand what they are reading. Not only that, to be critical of the reading, to be expert in writing, and number 4, that is always so difficult in some area of analytics, active listening and speaking. What's the use of all the information that you have if we cannot really do number 4 and 5? So the problem is not only the robots that are coming, and also in which way the robots are contributed in the development of the society, but at the same time, in which way we have to adapt our education in order to understand that. As you could see, I always put sources. The sources that you have there, when you receive the PowerPoints, are able to, do a little more research and understand the latest development here. Now, automation is the answer in many ways. Automation also could save jobs in other areas. But unfortunately, when I look at different countries, the United States has not kept up with other advanced economies with respect to automation. So what we see right now is that, once again, Korea, Singapore, Germany, and Japan are doing their best with respect to the creation of robots, especially in the area of manufacturing. It is true that COVID created many problems for the manufacturing industry, but I have to admit, countries like Korea and Singapore, they were able to take into account their sophistication in order to minimize all the supply chain blocks. And this was a surprise, not a surprise because it didn't work, simply because how human beings were able to adapt to new challenges. And we could see this in international figures. For example, Look at this. China is increasing, not only now, but in the past, automation with respect to the job. And if you could see the red line is China, see the things that it changed. I think China decided in the year 2013 on is to see in which way automation could happen. Unfortunately, there were many costs related to China. So one of the costs was unemployment, the redefinition, in which way. So we could see right now in the state of artificial intelligence in 2019 and 20 that with respect to China, annual installation volume of robots have increased tremendously and is much more apart. That helped China with respect to the supply chains during the COVID, to be able to handle in many ways all the challenges that China had. Also, some sad drawbacks. More than a year ago, the country which attracts much of the investment from Taiwan is trying to invent its growth strategy. And one of the problems that we are seeing here is 35 Taiwanese companies, including the Apple supplier Foxconn, spent 4 billion yuan, 4.7 Hong Kong dollars on artificial intelligence. As an example of loss of jobs, Foxconn factory has reduced its employee strength from 110,000 to 50,000. In other words, 60,000 jobs, human jobs, disappeared. And we could see this in China and some other countries. These are one of the drawbacks of automation, evidently. How are we going to teach the people that don't have a job in order to be able to survive? This is the responsibility that universities should have. Now, something that you considered in a very simple way is what Japan is doing right now in what they call Society 5.0, the super smart society. In other words, when we look at Industry 4.0, we see different industrial revolutions. What Japanese society is saying, listen, one of the problems that we have in Japan that we know by 2050 or 2070, the number of Japanese are going to decrease tremendously. The human beings are going to decrease. Our life expectancy is increasing, so we're going to have thousands and thousands more older people, millions of people over 60, and we're not going to have so much children. So this is unavoidable from the perspective of the Japanese. So they wanted to create this society, they call it Society 5.0, that is the big society transformation plan in Japan. What is Society 5.0? Society 5.0 is based on 4 pillars. Number 1, Internet of Things, in which everything is connected. Number 2, the data that you could gather for all the appliances and all the sensors that you have, big data. In which way decisions are made, artificial intelligence, and number 4, the robots. This is a society need that Japan has, simply because they may not have enough people, and also the idea of accepting the role of humans with respect to the robots. It's a different perspective, but this is the perspective from Japan. Remember, 5.0 has 4 pillars, and these pillars that you have there are part of the modern society. Now, the innovation that we are seeing right now in the last 7 months with COVID-19 is pushing us to see these 4 pillars as an integral part of the society. Now, who's investing? The geographical impacts of artificial intelligence. So they're looking at here is the influence. What is the impact when you are? So it seems to be that North America and China stand to see the biggest economic gains with artificial intelligence between now and 2030. So as you could see here is that there's going to be an investment associated with that. You have the investment in brackets, and at the same time, the total impact. What does it mean, the total impact? In this particular case, they are telling you, we're investing in artificial intelligence billions of dollars, but with respect to the GDP of your country, if you invest wisely. Unfortunately, one of the elements that we have that is not the same in all the world. We could see that China and United States are investing drastically as Northern Europe. But if you look at Latin America in many ways, the investment is much less. You have 2 sources there to be able to explore. So in other words, we are relating the investment of artificial intelligence to the enhancement of the GDP. And in this particular case, we think that the GDP is going to increase for North America at 26.1% and in China 14.5% in 2030 in comparison to now. So what we have here is a complex situation in which the rich country are investing tons of money, but at the same time, the enhancement of the GDP in those countries that have the resources are increasing more and more. Now, let's talk about our friends very briefly, the cobots. A cobot is simply a robot that does collaboration. Cobots. The collaboration of the robots and automation could be, I could coexist, I could cooperate, and I could collaborate. The basic idea is, in this particular case, that we see a robot not as a competitor, but as a collaborator. And we see much more in the area of COVID-19, in which these robots that clean, talk, or accompany or lift, in this particular the patients, are useful in many ways in order to be able to solve the problem. Now, this is a sawbot, a humanoid sawbot. What is a sawbot? It's a social robot. Remember, in the first PowerPoint that I have, one of the elements that I have is that those ones that are greeting the people, helping the people, they do much more than that. If you are a nursing home with older people, these are the ones that lift the patient. These are the ones that talk to the patient. One of the things that we are discovering that we needed before, in many cities in the world, the people are living alone. Right now with COVID-19, this degree of isolation has become obsessive, and this degree of isolation has not only affected older people, but the younger people also. I don't know if I have too much time, but let me continue. Let me give you a definition. Artificial intelligence refers to the use of data to simulate human intelligence, process included learning, reasoning, and self-correction by machine. Artificial intelligence is making its way into almost all the industry, but in order to have artificial intelligence, I need data. I need the data in order to be able to improve any prediction that I could do, the interaction with you. If you hear what I'm saying, I am a sawbot. 3 definitions, you guys. Artificial intelligence, in a simple way, refers to the ability of machines to exhibit human-like intelligence, solving a problem. There are different varieties. You have artificial intelligence, you have machine learning, and then you have deep learning. These are the basic idea. Please take a look at the definition. What is artificial intelligence? Machine learning. Remember, machine learning is the area in artificial intelligence in which a vast of money is being invested. How much time do I have left, Amy?
We're at 12:32 right now.
How much time do I have?
I would say maybe 10 more minutes.
Okay. You guys, this is what the companies are doing at the moment. When are you going to deploy artificial intelligence? So 9%, this was, by the way, this is a Gartner in the United States. There was last year, 2019, and this is what they got. They asked the executives, 2,882 executives, says, listen, which is the situation with respect to this? This is 9% has no interest. This was last year. 29% says plan to deploy in 2 or 3 years. 25% will deploy in 12 to 14 months. 23% will deploy in the next 12 months, and 14% have already deployed. This was a year ago. With the advance of innovation and the situation around the world, all these numbers has changed. We don't have any new surveys, that I could refer to, but at the same time, between robotics and artificial intelligence was pushed in such a way. Why do I insist that artificial intelligence is so important in COVID? Well, let me give you some examples. You guys, this is a state of the art. This was 2018. This is 2020. This was January 10th, 2020. 6 to 1 of business executives with an innovation strategy say that artificial intelligence helps them to identify otherwise missed opportunity in the data. So data discovery. 57.6 billion will be spent globally on cognitive and artificial intelligence by 2021. Also, 70% of business decision makers at work can focus on more meaningful work in artificial intelligence. So what they see in artificial intelligence is not only discovery, but seeing the opportunities they could exploit in the future. But this was January of this year. Unfortunately, with all the development that we are seeing, we have been pushed in order to increase the accuracy and ideas with respect to artificial intelligence and robotics. So sometimes 47% of executives say it's challenging to integrate artificial intelligence initiatives. But unfortunately, even though it is difficult, we need to go ahead and do our best. Now, one of the questions in artificial intelligence and robotics, you remember one of the PowerPoints that I show you in which there were horses and there were cars. So all the fear with respect to robots that are going to take our jobs or artificial intelligence that are going to replace us always are going to exist. So imagine in this ingenious economist graph in which the artificial intelligence that is not necessarily a robot looking at us saying, what do I do with this? In the same way that the horse were taken away. But this is quite melodramatic, but from my point of view is the fear that we have with respect to innovation and also the preoccupation that we have with respect to our jobs and in which way we could create new jobs for the people who don't have them. Now, artificial intelligence is playing right now a very big role. This cloud that you see here is the combination of the epidemics, COVID-19, artificial intelligence. So what do I need for artificial intelligence right now? What do I need for big data? Well, first of all, try to determine there is an epidemic. And also the concept of epidemic intelligence. The idea of intelligence, the idea of innovation, the idea of surveillance, the idea from open sources so everybody has the access to that, the idea of network. All these elements that you see here is in which way the new epidemics that are coming our way and artificial intelligence could help. We see different areas in artificial intelligence. You guys, first of all, let me show you a simple idea of the first data survey. Philadelphia threw a big party after the First World War that gave thousands of onlookers the flu. You remember the Spanish flu. Philadelphians were exposed en masse to the lethal contagion widely called the Spanish flu. For Philadelphia, the fallout was swift and deadly. 2 days after the parade, the city public health director, William Grosser, issued a grim pronouncement. Using the data, the limited data that I have, within 72 hours of the parade, every bed in Philadelphia, 31 hospital was filled. In the week ending, 2,600 people in Philadelphia have died. A week later, the number rose. Please observe, they were able to make those decisions that were so drastic through data. And through data and artificial intelligence, we expect to do exactly the same thing. It was Philadelphia in the big parade. There were other, as you remember very well, other epidemics. This is from Nature, from Time, and Business Week. But a simple way of reminding us how little we have planned or thought was the word from Margaret Chan, a wonderful doctor. Says, for the first time in human history, we have a chance to prepare ourselves for a pandemic before it arrives. This was on November 4th, 2005. It is incumbent upon the global community to act now. Well, listen, these are wonderful words. It seems to be that the world forgot these words, and unfortunately, we were not as well prepared for this pandemic as we expected. Now, with respect to leadership, we have to learn certain things that we didn't know before. Because how do I interact in this particular case with the people that work for me? Imagine you're a big company, you're in a hospital. So what is leadership in times of crisis? So the reason I'm saying this is because this is a symbol of leadership. This is for businesses. It says, listen, explicit and transparent communication. This is the situation. Keep the running effectively and securely if you can. That's why most of us are working from home, out of the office, but not out of the work. Engage and engage and engage and lead through and beyond the virus. Unfortunately, as you know very well, the economic situation around the world is disastrous. Poverty is increasing because it's very difficult in this particular case to get the data and to know what to do in time of crisis. Now, in the last minutes, I wanted just to mention some tools of artificial intelligence applied for COVID. There are many areas. The areas I want to emphasize is medical, which includes individual patient diagnosis and treatments, molecular, comprising drug discovery-related research, and society, everything based on big data. The four main areas of artificial intelligence and COVID are: number one, the medical scale. Try to predict, for example, I'm going to give you some example, the patient outcome prediction, non-invasive measurements for disease tracking. Number two, the molecular scale, drug discovery. There are many drugs that were developed in the past, and we were not able to make the connection about the discovery, the effectiveness. Number three, epidemiology, infodemiology, in which with the information provided not only to the patients, but at the same time to the expert. And number four, data sets and resources, biomedical data, textual data. I want to do text mining, so in this particular case, I can understand what is happening. And we see that in China with text mining, that millions and millions of texts were analyzed by the Chinese government in order to determine if the people were sick, or at the same time, if I could predict the situation like that. Four areas: medical scale, molecular scale, societal scale, and databases and resources. I want to mention as an example, companies. Blue Dot is an excellent company. Blue Dot Artificial Intelligence worked of the threat several days before the Center of Disease Control and Prevention and the World Health Organization. And also other companies associated with that. Benevolent Artificial Intelligence, a London-based drug discovery company. So Blue Dot tried to create a model to forecast, and they mentioned that before they saw that the epidemic was coming. And Benevolent AI was trying to do drug discovery. Could it be the drugs that were developed in the past? This is an example. Could be useful for the near future. And some little examples before I forget. This was in China. There was much early examples. Chinese hospital uses robots to deliver medicine. Doctors use robots to treat the patients in telemedicine. Robots making its first delivery to a hospital in Wuhan, and we are talking in February. And drones and robots in China. In other words, there were some people already just limiting their apartment in order to not go up or down the apartment. Simple drones were sent to where the apartment was. This is February 3rd. Imagine that in the Western world, how delayed we were with respect to this sort of innovation. And the last thing I want to mention is there are many applications, many tracing applications. The idea of the tracer that are applications, or perhaps they are human being, is one way to determine in which way the virus is spreading. Please observe that depending on the culture that you are, and depending on the level of sophistication, they may require different elements. Information disclosed that you have there, age and gender, travel history, workplace addresses, and so on. So imagine I am here in geolocation that is trying to create one way of predicting wave number 2, 3, and so on. And this is one way in which big data and artificial intelligence. The question is the coronavirus tracer eroding privacy? The concept of privacy could be different from culture to culture. And before I leave, I have this photograph, you guys, because we don't have time. of a baby in 1818 during the Spanish flu, in which the parents were intelligent enough to put flu precaution. Please do not kiss me. You guys, it's a pleasure to be with you today.
Thank you, Professor Guerrero, for your wonderful presentation. There are some questions, and I encourage everybody to ask your question. Por favor, hagan sus preguntas. Si quieren escribirla en español, no hay ningún problema. Mándennosla por el chat. And I have the first question here. Do you think that people realize that robots are not only taking jobs away, but helping them in extreme circumstances such as COVID and other pandemics?
I think right now the people are going to realize, especially with the effect that has in the healthcare industry, and first of all, the number of doctors and nurses that have died around the world because of the COVID-19. China was one of the first ones. China did it for two things. First of all, because it was a challenge for them and they needed the resources. And second was the idea of the researching constantly to see which are the capabilities. We see this not only in China. Remember, China is one of the most evolved in the world with respect to robotics. We saw this in Italy because we begin to realize that the human part was exhausted. Everybody, the nurses, the doctors, the cares. Then as the time was elapsing, the service industry was in case of default, economic default, so they have to reinvent themselves. I think it was a wonderful idea that the Tokyo government was able to engage those hotels. There was some sort of trade-off. They're going to facilitate the hospitals to reach a minimal level for light cases, but at the same time give those hotels that were in a disaster economic situation a second chance with the use of robots and nurses.
Mm-hmm. Thank you. Second question, has COVID increased the speed of innovation in automation and artificial intelligence?
Well, I think that what COVID has done in a very short time is to alert the people of the potential help of automation and artificial intelligence. Very quickly, the Chinese government began to realize, and the Italian government, that the resources that they had was not. And at the same time, robots deployed in manufacturing are going to be more useful, especially because at the beginning in China, many of the factories were closed, given that the workers were sick, and also the idea of having people working together without any social distances created a problem for the supply chain. So what we're seeing right now is that we're using tools that were experimental, especially in the discovery of drugs and things like that. And it has pushed tons of scientists, not the only scientists that are doing research with respect to vaccine or elements like that, but try to imagine or reimagine how the society would be in 5 years. This is not going to be the last epidemics around the world. There, as one presentation I gave, there are more viruses than stars in the sky. So one of the elements that we have to think is that has changed our approach and mentality. And I think it has helped in the future to really see artificial intelligence, robotic as an integral part of the society.
Okay, we have another question. How to address the current dilemma?
Hola. Hola.
Sí, how to address the current dilemma that some companies are facing today. Lost revenues, 65% due to COVID, impacting cash flow and ability to invest in new technology.
Well, listen, this is one of the biggest problems that we see around the world. The decision has been totally different. You know, some of the countries are trying to help subsidize those companies, giving money, or at the same time, giving loans. The sad thing about this is that for a company to work, it does not only need the government help, but at the same time, how society feels with the evolution of that. It's a very tricky question because the people try to reinvent themselves. It depends on the society. Some society has adopted this situation as, well, listen, this is what we have to do. The quarantine of countries, 4 or 5 months, have helped us to minimize the number of deaths and also to have less load on the system. But bankruptcy has been declared around the world. So the situation is very complex. To work from home, it's a wonderful idea if you could do it. But let's be honest. If you want to work from home, it assumes that you have internet, that you have a computer, that you have a camera. And that could be possible in many countries in the world with people who are professional or companies that could do that. But that's the reason so many jobs were lost in the US. And remember, I think it was one of my PowerPoints, the possibility of the people who are dying are the people who have this interaction with the public, not only the doctors, the lowest skilled workers and things like that. So this creates, for many governments in the world, one way, how do we survive? We are trying to, to balance the survival with the economic. And this situation is going to stay a little longer. No te escucho.
I think we have the last question here. Who is the winner in the innovation race?
Well, this is an ample question, a general question. I think that the winner in general is society. But at the same time, for society to be a winner cannot only be in the development of innovation, but at the same time, in which way innovation is going to bring back all the advantages to the benefit of the society. We are seeing, from an academic point of view, we are seeing wonderful things that are happening. The only question that we have, all these things that are happening are going to benefit the society, will be for everybody or some part of the society? Mm-hmm. If it's only some part of the society in which they have a higher skill or have more education, that's not the central part of innovation. Innovation should spread, or better said, should benefit every element of the society. Otherwise, that innovation is just for a minute group of people and is undeserved.
Okay. Finally, has artificial intelligence helped in the fight against COVID?
Has what, I'm sorry?
Artificial intelligence helped in the fight against COVID.
Yes, I think, let me go back to one of my PowerPoint. You guys, let me do the share. Could you see it? You guys, this is an example. This is an example in which way artificial intelligence has helped against COVID. The 4 areas, the medical scale, the molecular scale, the societal scale, and the data sources. I want to mention all of these are data-driven. But if I look at number 2, the molecular scale, drug discovery is an incredible element in which supercomputers are working and try to figure out, listen, we have so many things that we have done, drugs that we have. Let's see the combination they have. And number 2.3, drugs repurposing. We have some drugs that were developed in the past, were used for something. Let's see if this use could be secondary use in order to help those patients. Number 1, this medical scale, there are many elements, non-invasive measurements, and patient outcome prediction. What is going to happen to this patient? From a medical point of view, makes a lot of sense. Perhaps we say, oh my God, what happened? They predict that the outcome is going to be negative. And that's the decision making related to the ethics about it. So artificial intelligence is working very hard, but at the same time, we cannot let the expert on artificial intelligence do artificial intelligence. For artificial intelligence to be understood, it has to be spread around society. That's why we need doctors, expert in artificial intelligence, lawyers, professors. Artificial intelligence could be otherwise a very rather obscure paradigm that some people, if you don't understand, you will not use it.
Okay, we have one more question. In your opinion, in Latin America, engineering schools, what will be the critical skills that we should prioritize?
Well, listen, let me show you here. Could you see this?
Yes.
So you guys, not only in Latin America and around the world, one of the things that we are seeing is that we have a bunch of people who are over-specialized, over-analytical, and that's excellent in many ways, but we do not want engineers to be totally isolated. The role of an engineer in the future, when they are engineers, are going to be managers, and those managers have to understand the complexity of personal interrelationships and also how business work. So where we're seeing right now that engineers have to reinvent themselves, not only engineers, data analysts, a statistician, all will consider hard sciences, because elements like the top 4 or top 5, I would say, active listening and speaking, otherwise the flow of information is going to impede further development and innovation. And I think around the world, engineering schools or technical schools are beginning to realize, I don't want an automaton. What I want is somebody who can make decisions and explain those decisions.
Okay, thank you very much. I think that's it for the questions for today.
Well, you guys, for me, it was a pleasure. Thank you, Amy and Consuelo, for introducing me and creating this. And all of you guys, many known faces, thank you for attending.
Hi, yes, I'd also like to thank everyone on behalf of everyone listening. We will be sending the slide deck if you're interested. And if you have any further questions, don't hesitate to contact us.
Thank you so much, Professor Guerrero.
Alex, it's a pleasure.
Thank you so much. Appreciate it.
Thank you, everyone else. Thank you, everyone else, for joining us. We hope you enjoyed and hope you will join us for future events. And goodbye.
Goodbye. Stay healthy and stay safe.
Ciao, ciao.
Ciao.